We know that if a mom is successfully breastfeeding when she leaves the hospital, she is more likely to continue breastfeeding. But so when I go in to visit them, I, ask them to share with me any concerns they have. I talk to them about how they're breastfeeding, and I try to observe it while I'm there so that I can, make any suggestions. And then most hospitals do have lactation consultants in the hospital, so I ask if they've met with the lactation consultant, and then the main thing is scheduling a visit a day or two after they go home, because it's fine while they're in the hospital, but it's when they get home is when they start to second guess themselves, because you can't see how much milk a baby's getting when they're breastfeeding. And so they're always worrying about, did they get enough? And, that's something that they need to feel comfortable that their body's providing for their baby. And if there's some risk factors, which there are, then going over what are some risk factors if the baby is a late preterm, like less than 37 weeks, or if there's any, oral abnormalities. There can be a host of issues that can be risk factors. So identifying those before they go home, going over that with the mom and dad, and letting them know what might be just a transitional problem, and then giving them some things that they can look for, like, wet diapers or bowel movements, or, what are some feeding cues. So going over normal things that the baby's going to display so that they can feel comfortable taking care of that baby for that day or two till they come in, and knowing they have an appointment in a day or two and that they can call.